Hello everyone, welcome to HelloDoc. Today we will be briefly going over hay fever, and as you know, hay fever is a very common condition, one that people quite often mistake for a cold or vice versa. So it's important we know about the causes of hay fever because that is ultimately the only solution to treating it. And we will also be covering the differences between the common cold and hay fever. So simply, what is hay fever? Basically, it is an allergic reaction to the environmental pollutants such as pollen, mould, dander, animal fur, etc. So it is an allergy to something. As we mentioned, it presents with symptoms that are very similar to the cold, but of course, a virus is what causes a cold and an allergen or pollutant is what causes hay fever. The easiest way to distinguish hay fever from a cold is by a fever. Now, not everyone who gets a cold gets a fever, but if you do have a fever, you know it's not hay fever. So in the Netherlands, 800,000 to 1.5 million people are affected by hay fever. So you know it's a problematic condition affecting us as well as those all around the world. And in fact, it is getting worse and worse with more pollutant exposure in our environment. So people with hay fever will have it worse during the time of the year that the irritants are around. So there are two types. Some people only get it around that time of the year, which is called seasonal hay fever. And for some people, it really affects them throughout the year, which is called perennial hay fever. So as you can see, tree pollen affects people in March to May because it is when it is in our environment, grass pollen during May to July, and weed pollen from June to September. So these are just some examples of the many different irritants. So why does hay fever happen? Well, the internal mucous membrane that lines the respiratory tract is sensitized by the irritant, which leads to an allergy against that irritant. We don't really know what causes a sensitizing process. All we really know is that it is sensitized in the respiratory tract, which triggers you to respond to that particular irritant. Some people say that you can't have hay fever in winter and it's more likely to be a cold, but that is not true. You can have hay fever in the winter depending on the irritant that causes your hay fever. For example, let's say dust. And in winter, you leave your windows closed most of the time. You're not letting that air cycle into the room and you're constantly trapping that dust inside. So we mentioned earlier that we don't really know what causes the sensitization process leading to hay fever, but we do know what some risk factors are that can make you more susceptible. If you have other allergies, you are more likely to get hay fever. For example, asthma, skin allergies, peanut allergies, etc. If you have hay fever in your family, you are also more at risk as there is a genetic link. Also, working in an environment that exposes you to an irritant as well. So with regards to this, it is quite an interesting point that studies have shown children who are exposed to irritants at a young age, let's say at kindergarten, are less likely to develop hay fever and allergies in the future. So if a child is brought up in a very hygienic environment, they can be more susceptible to getting hay fever or allergies in the future. I find this really interesting, especially because it explains why we see hay fever so common in developed countries versus developing countries. And lastly, smoking. If your mother smoked in your first years of life as a baby, that can also increase your risk of hay fever in the future. So what are the symptoms? So sneezing, coughing, congested or runny nose, itchy red watery eyes. You also get itchy nose, roof of the mouth and throat, headache, and in children you also get ear infections. So I would say the symptoms that distinguish the most between hay fever and a cold would be sneezing more often. Runny nose is very common in hay fever, and it also be quite a watery discharge in hay fever. And of course, itchy eyes, itchy nose, and roof of the mouth, as well as red, watery eyes, all differentiate a cold from hay fever. So they're more common symptoms in hay fever. Cough symptoms can be at any time in hay fever during the day, but they are quite often at night time with hay fever because the phlegm from the back of the throat triggers you to cough when you lie down at night. So this leads me on to some other points as well, which are more clear-cut with differentiating hay fever and the common cold. So onset. With hay fever, you start to get it immediately after being exposed, whereas with a virus, you will not get it until up to about 3 days after exposure. We mentioned that a fever is only present with a cold, and the duration of hay fever can last for as long as you're exposed to the irritant, which is why it is important to figure out what the irritant is. Otherwise, you will continue to have hay fever for as long as you're exposed. Now, with hay fever, you can take medication, which will mask your symptoms, but your body is still going to react to the irritant. So that's why it's important to do what you can to remove your exposure to that irritant. And with a cold, it will typically go away on its own and can last for only up to a couple of weeks. And finally, as we mentioned earlier, the nasal discharge is clear and watery in hay fever, but with a cold, you may get watery, thick, or yellowish mucus. So how can we remove those irritants from our direct environment so that we can get rid of hay fever symptoms? We can keep windows and doors closed to prevent pollen from entering, if this is the irritant, of course. If mould is the irritant, then a dehumidifier may prevent the growth of mould in your house. If pets or pet hair is what triggers your hay fever, then avoid them. And if you can't, make sure you wash your hands immediately after touching them. Wear a mask to protect yourself from any outside pollutants that you can't avoid, of course, if you are going outside. And some people's irritant is grass, so don't walk on grass. And finally, change your clothes, have a soothing bath after you go outside if you can't control exposure to that irritant. So quite self-explanatory, avoid the irritant and it can make your symptoms a whole lot better. Of course, sometimes we can try to eliminate the irritant or reduce our exposure to it, but it can be quite hard to completely eliminate it. So we may or may not need medicines to help with the symptoms. You can take a tablet form which can help with all your general symptoms of hay fever, and they are called antihistamines. You can talk to your pharmacist about which is most suitable for your particular condition. You can also buy nasal sprays, which are great for if your symptoms are only locally in your nose, and also eye drops are the same for if you have really bad eye symptoms alone. You can also take antihistamine tablets in addition to the nasal spray and or eye drop if your symptoms are really bad. So let's say you have all the hay fever symptoms, so runny nose, cough, etc., but really, really terrible eye symptoms, then you can take a tablet in addition to the eye drops. Of course, if your symptoms are still really, really terrible, even after using these options, then you can talk to your doctor about some further options. So feel free to contact us at HelloDoc and we can help with assessing your symptoms, so how severe they are, whether you need any special referrals, and we can also provide the referrals when needed. So thank you for listening, and I hope you have taken some useful information about hay fever from this video.